Ladies and gentlemen, we are now opening a very interesting session. We planned this to be the last session because we thought we could exceed our time a bit, as the issue discussed here is very topical, is very fascinating, and I'm sure we won't stop with this session. We'll have another separate meeting to discuss solutions, good solutions that could help refugees. In particular, help them navigate the Polish healthcare system, and also how to help LGUs in effectively reaching refugees. Let me kick off our session. I have to introduce everyone to you. This time we have a larger share of women among our panelists. I would like to just point this out to you. I would like to welcome Barbara Pepke, president of the Star of Hope Association, Madam Maria Piętak-Frączek, Mr. Serhii Pek, an influencer, that's what I would say about him, who runs social media channels for Ukrainian citizens, and also all those who know Ukrainian, and Mr. Marek Wójcik, who also accompanied us during the last session, a plenipotentiary of the Association of Polish Cities. And we have two ladies joining us online. Inna Ivanenko of Patients of Ukraine.
Good evening.
Good evening. Do you have already Polish translation?
Yeah.
Okay.
And Magda Ankierstein-Barczak, Foundation for Civic Education. And we have 224 viewers online. Ladies and gentlemen, we have taken up this topic because as we were cooperating with local governments in different projects and at different levels, we encountered issues related to the war in Ukraine, Russia's aggression against Ukraine, the refugees who have fled to Poland. In the situation of war, people leave behind their homes, everything they had, and due to these tragic events, they have to flee to different European countries and other countries as well. They have to deal with different healthcare systems, they have to overcome the language barrier, they have to find a job, they have to seek education and still cope with their family life. So this is a huge challenge. We were wondering, how could we facilitate communication about the Polish healthcare system? The Polish healthcare system is sometimes very difficult to navigate for Polish citizens, let alone Ukrainian refugees. We thought a session for exchanging opinions could serve as an introduction to work on improving communication about the healthcare system and drafting certain recommendations. In all local governments, we have Ukrainian refugees, that we can safely assume that. And most of the LGUs are thinking of how they can communicate effectively, not just on healthcare, but also other issues. So maybe what we will be discussing here will prove useful to you. Or maybe after the conference, you can contact us via chat or any other way to give us your ideas. First, I will ask Marek Wójcik for some figures and a sum up of some numerical data. Then Barbara Pepke will present us a practical perspective on the basis of one disease, and then we will give the floor to our friends from Ukraine, who will tell us how they respond to the Polish healthcare system, about their good and bad experiences, and about their ideas on how to help people navigate that system. We will also discuss how LGUs are coping with the crisis. And we also have the Social Education Foundation, which will give us the social perspective. So I hand over to Marek Wójcik. Ladies and gentlemen, good afternoon. I'd like to start with showing you how our new neighbors are using the Polish healthcare system. And I'll show you a short material which sums up how public funds of the National Health Fund were used to treat our new neighbors. Firstly, I will talk about those who received special rights to use the healthcare system. Of course, those follow from COVID regulations, which is congruent with the rights of Polish citizens. Those were 364,500 patients, Ukrainian citizens, who used medical services. In total, those were 1,147,000 medical services, and the cost of those was 581 and over 700,000 Polish zlotys. At first, the cost was was estimated to be 1 billion, then more or less. But those were our forecasts, and it turned out that the usage of our system is lower than expected. This came as a certain surprise. We were ready to allocate greater funds. Most patients used primary health care, 273,000 patients. That's about 70% of all medical services. Then stomatological services, 56,000. The medical services went mainly to children and youth. Almost 200,000 recipients were under the 18th year of age. That group was dominant. In terms of the number of medical services, about more than half of the medical services were provided to children and youth. For obvious reason, the smallest group was that above 84 years of age, the fourth age. But in general, those were children, youth, adults until a bit over 40 years of age. Those were the main recipients of the Polish healthcare system. What I also find interesting is the dominant medical services. And I'll tell you about something characteristic. Of course, mainly primary health care. Out of the 1 million medical services, about 626,000 was primary health care. Then stomatological services took second place. This was surprising to me. I didn't think this would come up so high. Then hospital treatment, 20,000, those were adults, 24,000, and 24,000 children. No, sorry, 24 to 26,000 children. Rehabilitation, those were mainly children. This is the most important slide in this material, and I'll stop here for a moment. Please pay attention to the fact that Ukrainians use medical service very differently from Poles. I'm talking about the frequency of using the system. Starting from primary care, the average Pole would use primary health care 6 times in the previous year, and Ukrainian citizens 2.3. Outpatient health care 5 for Poland, 2.6 for Ukraine. Stomatological services 13 for Poland, 2.2 Ukrainian. So insured Persons from Poland would use dentistry services 13 times a year, while Ukrainians much less frequently, just over 2 times. And hospital treatment just under 2 for Poland and just above 1 for Ukraine. This means that Polish insured persons would come back to a hospital after receiving inpatient care. This is an important difference also in economic, financial terms. The title of the slide is Who Uses the System Too Frequently, Who Uses It Too Rarely. It seems that what is the conclusion? We could say that Ukrainians use the system too rarely, but I would not agree. In Poland, we got used to using the system and we are overusing it. We're using it too frequently. And this issue has come up now that Ukrainian refugees are present in Poland. And let me tell you in a moment how we should approach this system. But first, let me show you this slide. This slide illustrates a big surprise, and I have certain doubts concerning, but still, this is a report of the National Health Fund. In this report for 2022, it was written, none of the patients used services in the areas of infectious diseases and extraordinary conditions, pilot programs, and prevention health programs. I think this is impossible. Maybe it's a problem with the codes used for different medical programs. The previous presidents of the National Health Fund could perhaps explain this, but it's impossible that no patient was encoded as the user of a medical service connected with these services, none from among the Ukrainian refugees of whom we have so many. This is also interesting. We can come back to this in our discussion. Let me tell you something very important to me. I hope it will be food for thought and an inspiration for discussion. We've gone through 2 stages. First, fervent support and assistance for Ukrainian refugees. Then the second stage, stabilizing the situation. I believe that without looking back, we should move on to stage number 3. We should treat Ukrainian refugees just like our Polish citizens, according to the same rules. We should make this the new normal without differentiating between them. Of course, this has various consequences. Still, I believe we should be doing that for our new neighbors who are important to us, whom we need. And I say that openly. As Tomek rightly said, they don't always have all the information about the Polish healthcare system. Very often they're afraid of the Polish healthcare system, of which we have proof. Therefore, we should help them navigate the system and learn more about it. Still, I think that it is high time that Ukrainian refugees understand this is their obligation and it's in their interest to learn more about this system, and we can't treat them like children who don't know how to navigate life. This may be controversial, but I want to stir up discussion. Before we hand over to our guests from Ukraine, I would like to ask Barbara Pepke, Madam President, to give us a short overview of a patient on the example of an infectious disease who calls in and asks for support in finding their way through the Polish healthcare system.
I represent the Star of Hope Association, which deals mostly with HCV infections and liver diseases, and renal cell carcinoma, which is the consequence of HCV infections. When the war started, our foundation wanted to learn more about the scale of the problem of the infection of Hep C and B in our guests, when we turned out that in this population it's a problem that is tenfold greater than in Poland, our foundation wanted to take up the challenge to help those people, especially since we had people with this hepatitis infection even before the war. We would help them find their treatment pathway, we would guide them towards the right experts. And here I would like to say a few words about what was said a moment before, because I also directed a question towards the NHF about how many people received antiviral treatment, and I also received information that I did not agree with. I didn't find credible, because I got information that some people received antiviral treatment. It's not like no one used that treatment, but when I showed this information to healthcare experts, they said that in all of their facilities, the number of patients who did receive the treatment was much greater than the official data. So the NHF apparently doesn't have the right data. It turns out that they showed only those patients who used the services only with a specific status, the UKR status, and everyone else who received the services with based on a different title, maybe they were calculated along with the Polish population. So Ukrainians have the same access to healthcare as Polish patients, either based on their UKR status or based on the Polish healthcare insurance. We know that, but I am really grateful also to various bloggers who support us, and patients of Ukraine and Inna Ivanenko, who provided us with their honorable patronage. Our knowledge and the approach of people from Ukraine has been expanding greatly. So we hear statements like, we came here, especially the people before the war, to work. We avoid primary health care. We prefer to take drugs on their own, to self-medicate. They do not want to present themselves as people with diseases. Very often, people who know that they are infected, they try not to divulge that situation. They are afraid of the sanitary infection. They are afraid they will not be able to work. They don't know what the sanitary inspection will do with this knowledge. Will I be able to work in a school? This is the reason why they tend to use healthcare services so little, because they are afraid. And another aspect which I find important, when we help people from Ukraine, I never saw a attitude which would be ungrateful. They are always thanking us for the assistance. Although sometimes in Poland they have been here for several years, they ask, what is primary health care? How can you get a GP appointment? And unfortunately, people who are infected with Hep B or C, they have to be guided step by step how they can go to a GP, how they can get a referral, where they can get specialist treatment. Thank you so much. Yes, maybe someone from Ukraine is listening to us. Please search for your GPs, for your primarily healthcare providers. This is the place which will directly further along your treatment path. You can change that healthcare provider later on, but it's a starting point. I also have a primary healthcare provider. Some people don't know who their GP is. I do have a GP selected. Thank you for this testimony, for this description. And now an important moment, because we will ask our guest from Ukraine. Ina used to live in Poland for some time. Now she will be talking to us from Kyiv. I'm saying in Polish and I'm wondering if she can hear us, whether she can hear the translation. Ina, the floor is yours.
Thank you. Thank you. I'm hearing you quite well. Thank you for inviting me. Yes, I'm now based in Kyiv, and I represent one of the biggest patient-based organizations in Ukraine called Patients of Ukraine. We unite patient leaders of 23 disease areas, and the representatives of my organization, one of them, now live in Poland with their families, with their children, and they are very active users of healthcare system in Poland, in Krakow, by the way, as well. So before coming here, I have had a conversation with the members of my organization who live in Krakow, in Warsaw. They are mothers of children with severe diseases. And, you know, in general, they are very satisfied with healthcare system in Poland, because if to compare to Ukraine, in Poland they can have access to different types of medicines, of diagnostics, even of medical devices for children, for example, with cerebral palsy or with epilepsy, which is unfortunately not accessible and available in Ukraine, because we have budget limitations on the state level for healthcare services. But of course, there are some issues. It's the problem how to get the information about these services and medicines which are available in Poland. Sometimes they need to seek for this information and to go some rounds, first to GP, then to specialists, and they told me the situation when, for example, there were no free places in GP, and the GP couldn't prescribe medicines for their children. So what is the algorithm? What are the next steps for Ukrainians if there is no free spaces in GP? What should they do? They really don't know. And in this situation, mothers just go to emergency and wait for the doctor appointment, and after that the doctor appoints medicines and gives a recipe. This is not the best and the right way to receive the recipe for the medicines for their children. I understand, and they also understand, but they don't know the right algorithm. What should they do in this situation? That's why they tell that it's very important to provide the information for Ukrainians through existing Telegram channels, through Facebook pages, and to work with media which work in Ukraine for Ukrainian citizens in Poland. these are the most right ways how to reach Ukrainian patients, not only with severe diseases, but general population of Ukrainians who are currently living in your country. And of course, we are very grateful for the possibility that you treat Ukrainian citizens as Polish citizens when we are talking about healthcare services.
Thank you very much. Ina, it's obvious you have to be treated the same way as Polish citizens. To jest również bardzo ważne, żebyśmy słuchali.
It's also very important to listen, to hear the Ukrainian citizens out and what possibilities of communicating with them they see. Unofficially, I gave some examples of communication channels. The Ministry of Health or the Institute of Occupational Medicine have part of their websites in Ukrainians. They have information on preventive examinations targeted at Ukrainian citizens, but very few Ukrainians visit such websites because we communicate completely differently. Honestly, when I need to check something, I don't go to those websites myself. So how can we effectively reach Ukrainians? That's the only way to achieve our common goals. Thank you so much, Ina. Please stay with us because we will move on to the discussion. And now over to Serhii Pek from a Ukrainian organization which is based in Krakow. Serhii calls himself an influencer. He uses social media for good cause. I think he's the best person to tell us how this communication works within the group of Ukrainian refugees, and he can tell us how we can use different channels of communication to reach people with our message, for example, about prevention, telling Ukrainians that they need a GP.
Thank you. I'd like to welcome everyone. And firstly, on the behalf of all Ukrainians, I would like to thank Poles for the assistance they have provided us with and will provide us in the future. I would like to thank you for all the 5 years I've lived in Poland so far. I've managed to integrate here. I actually have a Polish wife and a daughter here. And I can see all that from different perspectives. I can see both the Polish side and the Ukrainian side. And to be honest, I've never seen a bad situation somewhere where I heard something negative. But when we talk about websites in Poland, I'm sure not every Pole even visits those websites. And Ukrainians, well, I'm sure that they don't really visit those websites because, first of all, they don't know that those websites exist. And secondly, no one tells them that they are there. Thanks to people like myself, we try to reach those people because otherwise it's impossible to get the message through. I'm sure that the people who are listening to us right now have their own influencers whom they watch, whom they follow every day. When we're talking about Ukrainians who came here, and this year it were around 3,200,000 of people who are living permanently in Poland or come back occasionally. Not everyone knows Polish. If they have a refugee status, they don't know Polish. It's impossible to learn the language in a few months if you work every day and do one job day after day. But there are people whom they will understand, whom they can listen to on their headset during work, because like people like myself, because I use a simple language, I try to reach millions of people. Because first of all, when the war started, we would organize ourselves uh, into one community, Poles and Ukrainians, and citizens from different countries would join us, and we worked as one. To me, it doesn't matter what nationality a person is. It's important it is a human person, and we have to help all humans, especially if those people can't help themselves. When I'm talking about my achievements, within 4 years, I have managed to achieve around 500,000 of followers. What does it, what gives me, what advantage do I have over the governmental media is that I'm being heard by thousands and thousands of people every day. And every month I'm being watched by millions of Ukrainians, not just in Poland, but across the world. When we talk about how we should reach the Ukrainians living in Poland who don't know which benefits they can use, how can they get free of charge drugs, or how can they get services promoting health, which is our most important value, I think that if we address influencers and they promote the knowledge in a clear, legible language, we will achieve this success. Why am I showing this door on the slide? If we knock on one door and they don't open us, we should simply understand that we can't reach them. But if we knock every day, well, sooner or later this door will open and we will find a solution to any situation. If we have a program, let's say for a specific treatment, we need to have that program on our agenda. And when we start implementing that action, we have to follow whether it has an effect or it doesn't. Because if there's some information on a governmental website that some program exists, even if we translate it into Ukrainian, we don't know whether people actually access that information, whether they go to the website. But if as an influencer, promote a program, I have a specially designed link which allows me to see how many people followed that link, how old those followers are, at which stage they are, whether they opted for the program or they didn't, and we can adjust the program to that knowledge until we are successful. Private companies already do it. However, currently, influencers are not taking that seriously, but I am sure that in the next 5 or 10 years, everything will change, and this television that a lot of people watch will turn into something that will be watched by many people. So social media platforms will be watched because very swiftly we can promote any information. And people trust those influencers more rather than talking heads on the TV. I don't know why that is the case, but it is the case. I think that bloggers in the future will become politicians. Well, I hope I'm wrong, but it is possible. But when we're talking about health, health is the most important aspect. We should help one another, and only that way can we be successful. Sergey, thank you for that. We can see that Sergey has a lot of screen time every day. My younger son would say that you're quite the guy. But it's important. I think that every local self-government has an influencer somewhere in the region, or they can find one. I am anticipating that in cooperation with the Association of the Polish Healthy Cities, we can develop some broader communication strategies. You might be interested in contact details to people who can effectively get the message through. This conference regards health, so we'd focus on health and prevention. I think that some local self-governments could also be interested in getting the message through on other topics, not just the health-related ones. Now we are moving on to another thread. I will now switch places with the president, who will be presenting her presentation on the refugee crisis and how local governments face that program, who are united in the association. Over to you.
Ladies and gentlemen, welcome. My name is Maria Piętek-Frączek. I represent the Healthy Polish Cities Association and also the city of Krakow, where we are here today, offline or online. Thank you for staying until this very last session. I just wanted to add something from the local governments on behalf of the Healthy Polish Cities Association about the refugee crisis. As you're surely aware, we estimate that more than one-third of Ukraine's population has fled not just to Poland but also to Europe and other countries. This problem, which surprised us, which emerged suddenly, caused European states and the Polish population to express solidarity with the Ukrainian population. We quickly responded to the needs of Ukrainian refugees. We provided shelter, security for the time that they need to wait in Poland to return back to Ukraine. About 1.5 million Ukrainians have reached our region. But as you can see, migration is ongoing and the traffic is working both ways. Therefore, LGUs have to deal with a serious challenge, that is implementing assistance strategies as fast as possible to secure the living needs of refugees and also responding to those needs reported by Ukrainian refugees. We decided to conduct a study initiated by the Healthy Polish Cities Association, by local governments, but also the WHO, which also deals with this issue. This is a map of the cities which are active in our Association of Healthy Polish Cities. This is a representative group for all of Poland. This study was aimed at diagnosing three areas. The first area were health problems and social problems of refugees. The second area, the forms of actions taken to the benefit of refugees. And the third area that we wanted to diagnose is the knowledge and skills acquired due to the refugee crisis by representatives of local governments, of institutions which were active in the examined cities. And we wanted the results to initiate a long-term intervention recommendations so that we could adjust our response to the needs of migrants, contrary to what happened at the beginning of the war, where we were surprised and had to take immediate actions. As concerns methodology, we used surveys in the cities associated in the Healthy Polish Cities Association. These surveys were conducted during the summer holidays, so after a year of the war. And we had 39 Polish cities participating. 25 cities responded to our survey. And this is a sum up of the responses. The cities are divided by population size, and we also have the proportion of accepted refugees to the population of a given city. I use different shades of green to highlight that. We have such cities as Warsaw, Kraków, Wrocław, and Poznań, Rzeszów, and Białystok, which have accepted the highest numbers of refugees. Let me discuss the results of our study. The first one was identifying health and social problems. The most common problem reported by cities were chronic diseases, for example, diabetes, cancers, cardiovascular diseases, and also disabilities caused by injuries. Then we had addiction and violence, PTSD, epidemiological threats, for example, measles, hepatitis, TB, and others, poverty, risk of pregnancy loss. Those were the most common and most serious problems that we diagnosed in the study. Then the next areas, the forms of actions. So what should be implemented by LGUs and in what areas? At the top of our ranking, we have assistance in providing living conditions, childcare. I will discuss this in further slides. Preschools, creches, education in schools, and also assistance in securing a job. Another important area was psychological assistance. Another important area was access to primary care, to preventive medical examinations, also preparing websites in Ukrainian. I will tell you how that was done in a moment. So living conditions, childcare, education. So we provided temporary places of stay, social support, childcare creches, kindergartens, adjusted to the needs of those children. Psychological and legal support was provided. Another important area. Most cities which participated in the study provided such aid. And services rendered to refugees. As concerns psychological help, we have a wide range of medical services provided here, a psychotherapy, a consultation, and also advisory for public institutions which were not prepared for the challenges they had to face. Another important area, preventive vaccination and motivating refugees to accept such vaccines. We had different types of campaigns. Every city used available channels of communications to promote preventive vaccination. We also had a big campaign prepared by the Ministry of Health and UNICEF. And all of the cities of the Healthy Polish Cities Associations participated in the campaign to encourage accepting vaccination. We had high hopes that we would encourage not just refugees, but also Poles, Polish citizens, to use these services and to benefit from our activities. Now, the websites, the hotlines, the leaflets, hiring interpreters, of course, we prepared information in Ukrainian, but also in Polish and in English. We decided that at the beginning, Ukrainians would end up in a Polish home. That's where they would find shelter. And we thought that Polish citizens would also read that information, and so we could disseminate such information. They would be the first link in the chain of passing on information to Ukrainians. Expanding access to diagnostics and treatment. Let me give you the example of Krakow. We had a special panel for Ukrainian children in the Stefan Żeromski Hospital in Krakow for children aged from 0 to 18 years of age. The parents also received guidance on the next steps to carry out the medical examinations. And other cities of our association also conducted such panels. Antenatal education, another very important area. We know that many pregnant women have fled to Poland. So we provide help in the antenatal period, during pregnancy, and during afterbirth. This was one of the activities taken by our cities. Further activities promoting preventive diagnostic medical examinations, HIV, syphilis, HCV, and treating diagnosed patients. Another very important issue for us, education for local government officials, assessing the knowledge and the skills that were acquired as a result of the refugee crisis. So, voluntary activity, cooperation between different entities, business, NGOs, LGUs, entrepreneurs. Acquiring such skills as crisis management and organizational logistical skills. Those skills had to be quickly acquired by LGUs, and I'm sure that they will use them in the nearest future. To sum up, we try to diagnose healthcare problems, social problems of the migrants, also the types and forms of activities taken by cities, and the skills and knowledge acquired as LGUs during this period, which lasted over a year of providing support to refugees. And we hope that these experiences will be used in all walks of social life, also in all areas of healthcare, and we will use them to resolve any emerging problems.
Proszę Państwa, teraz zrobimy...
Thank you so much. And now we'll do it this way. I will ask Magda Engelstein-Barczak to talk about her perspective on cooperation with refugees. The Social Education Foundation is very active in this regard, and it also covers one of the areas that is treating HIV and AIDS, which is quite a specific area in Poland where we have a centrally managed distribution of drugs. From that perspective, I would like Magda to talk about this specific issue, and then I will ask each of our panelists for a 3-minute set of recommendations, because we need to hear one another and hear each other's viewpoints, also addressing the Ukrainian friends, so the local governments do think about you. This is best proof that you are important to them as well. Question is how to reach you best, how to provide you with information. If I was to end up in Ukraine, I would also not know who to go to, who to turn to go to a GP, for example. Magda, over to you. Hello, ladies and gentlemen. Thank you for this possibility of taking part in this interesting panel. Like Tomasz said, I'm running this foundation. We are dealing, among others, with HIV and other sexually transmitted diseases. Under our care, we also have people who have HCV, because we test in that regard, and also we test for syphilis. So 2020 was quite a surprise for us. But for many years, the foundation has been cooperating internationally with various stakeholders, so it became the first organization to be the contact point for people coming from Ukraine. As already mentioned by our guests, we had actually 3 waves of refugees from Ukraine. The first one were our Ukrainians who would live in Poland and work in Poland for many years. They were working here legally, and they were the first ones to turn for assistance to us, because when when the war broke out, the full-scale war broke out, they knew that they wouldn't be able to return to they would not be able to return to Ukraine for the drugs. Ukraine has a huge amount of support from the Global Fund, and NGOs have a lot of NGOs in Ukraine have a lot of support from the Global Fund. They have full-time workers, and they are implementing specific actions. So the first people who turned to us were people who normally would get drugs from Ukraine, but they were not able to return there, so they needed antiretroviral treatment. Then came the people who would visit, who would come to those Ukrainian people who have already been here in Poland. And the third wave, which was of key importance, so people who came straight from the war, who came to the eastern train station where we would have voluntary workers as well. So the system of providing care to HIV patients is very good. It's good because we don't have any divisions, regional divisions. It can be an upside or a downside, because we have 17 centers across Poland who treat HIV patients, and there's one voivodeship, one province, where there is no specific center. That's Podkarpackie, so Rzeszów. So this is the point where a lot of Ukrainian people would come, and unfortunately that's the one place, one voivodeship when no such center was there, so they had to go to a different province. Another challenge we faced was taking care of people who were under the age of 18 and were HIV infected, because there are only 5 centers taking care of pediatric HIV patients. In the past, we had only around 100 people, pediatric patients with this problem, because for many years we have been performing HIV testing in pregnant women, and only this year we had an additional 100 pediatric HIV patients, and they require a different type of care than in the case of adult patients, because an adult patient can come every 3 months, take the pills and undergo tests every quarter. In the case of children, hospital stays were necessary, and that was the source of a lot of anxiety. And what is of key importance in all that? The National Center for AIDS provides data which says that we have around 3,000 people from Ukraine with AIDS treatment. So this is an increase by 20%. So the drug supply was not really a problem, but we managed to increase the supply, but we have not managed to increase the amount of the healthcare personnel. So a Ukrainian patient required more assistance, sometimes a translator, and doctors or nurses would try to somehow manage as part of international cooperation. They would cooperate with Ukrainian doctors, but when the energy crisis in Ukraine came by, the communication was more difficult. So it was also important for us to start our services. We'd open points for anonymized testing for HIV for Ukrainians. We encourage people to test themselves. There are almost 30 points across Poland. And what was also mentioned, there are various barriers why people don't want to reach out. They are afraid of the sanitary inspection. So people who come to us are not just from Ukraine, but from other Eastern countries as well. So they are experiencing this fear. Who will be informed about my infection? whether I will not be expelled from Poland. Obviously, people are not thrown out from the country if they are infected, but the fear is there. So we have to do a lot of groundwork to make people confident they will not be discriminated against, and reassure them that they will receive equal healthcare as Polish citizens. It is important that people get tested. It is important that people get treatment. What we can learn from the Ukrainian people is how broadly we can implement prevention. For example, in Ukraine, there is free of charge preventive treatment. Thank you so much. We know more and more right now. Today, we'll not be able to solve all the problems. Today, we need to come up with initial recommendations and think about what further steps we could take so that the assimilation of our neighbors in our healthcare system is as streamlined as possible, and how we can cooperate in this regard. Because it's best that both sides cooperate, because it's very uplifting. So if I could ask everyone to, with all our panelists, to sum up. Let's start with the Star of Hope Foundation. What I found quite reassuring is I asked my HCV patients, how should I reach this campaign, with this campaign to Ukrainians. We listened to bloggers, and I felt quite relieved because I want to do one thing with my foundation. We don't want to reach the Polish society with the message that Ukrainians have a greater problem with infections. It could only lead to stigma. We have to continuously work. It can't be just one video. I could see that some videos posted by bloggers had a lot of viewings, but this was not followed by this significant uptake in free of charge testing. Why? Because that fear is still there. We have to continue taking those actions. So that's why we ask for support, we ask for help, and when we see how interested the cities are, I hope we exchange contact details. We didn't address specific cities because we hoped that that the cities would promote information that might not be beneficial for Ukrainians. But if we provide them with videos saying that there are over 400 testing points, that we have websites in Ukrainian, then I think that might be a very beneficial thing. And I also would like to send my greetings to Inna and Magda, and I'm really happy to see Inna Ivanenko in such a good health condition. So I would like to officially invite the president of the foundation to our upcoming workshops, where we'll have the chances to talk peacefully about cooperation, about the tools, and we'll definitely work out something. Now, Sergei Peck.
What can I add to the issue of recommendations? If we ask small children, who do you want to be when you grow up? The answer will be influencer, blogger, or maybe I want to work in IT, because that's what brings in the most money. Why am I saying this? When local government organizations and NGOs cooperate with influencers, such cooperation can be much more successful, much more positive. Everyone will achieve success. Everyone will be happy. If we look at Polish bloggers, the top Polish bloggers, and I follow them, I can see how they break global records. They gather so many people in football stadiums in cities. And what they're showing is that bloggers can help as well. They help orphans. They help those children who have lost their parents. What Tomasz said. What would a Ukrainian arriving in Poland do? Well, they would listen to bloggers. That's what I would do if I went to the US, to Israel. I spent 11 months there, and that's who I listened to bloggers who told me how they traveled, how they crossed the border, and so on. We exist to help, and I hope that together we can achieve even greater success. Thank you. Now I will certainly listen to bloggers whenever I travel, just in case. We can also learn a lot about different countries and healthcare as well. Madam Maria Piętak-Frontek, your recommendations. In my short presentation, I wanted to show you cooperation between cities, that we are trying to find a uniform approach to exchange experiences and knowledge. We've learned a lot, but thank you for today's meeting because I really benefited a lot, and I will pass this on to our member cities because there are so many challenges ahead of us. Thank you for today's meeting, for the new experiences, for exchanging our contact details, for new ideas for cooperation. I'm sure that we will stay in touch. Thank you. Thank you. And now our online participants. Ina.
We would like to listen to your recommendations.
Before going to recommendations, I would like to say thank you again for all the possibilities which Polish healthcare system provides to my compatriots. It is very valuable. If to go to recommendations, in case you want really reach Ukrainians, I think the best way is to go to the places where they spend time. I absolutely agree with Sergey, but in addition to what he's told, I would recommend to work with Ukrainian Telegram channels, with the Ukrainian Facebook groups in Poland, which exist in Warsaw, in Krakow, and in other big cities of Poland, because I know for sure that Ukrainians get the information from these channels. They just scroll their smartphones and spend a lot of time seeking the information in these Telegram and Facebook groups. And also, of course, they are active users of Ukrainian mass media, which work in Poland. So it should be very simple, in very simple words. Information should be provided, and in Ukrainian, of course, because they would not go to websites, to official Polish websites seeking for some information. It's much more easier for them to open the groups where they use every day and to find the information they need there.
Thank you very much. We surely stay in touch after this conference. Proszę Państwa, Magda Ankerstein-Barczak.
Ladies and gentlemen, Magda Ankerstein-Barczak, your recommendations. Let me come back to what Marek said at the very beginning of our session, that we should start thinking in the long term, and we should treat Ukrainians and also other migrants as part of our Polish society and adopt long-term planning for educational activities. We should also adjust, for example, by translating different materials into Ukrainian. We should reach that group via very diverse channels. I also encourage Ukrainians to feel as if they were at home in Poland and to use whatever we offer because they're part of our society. A lot of them have already decided to stay in Poland for different reasons. And we should provide them the possibility of becoming anchored in our system and getting our support. What is important from the perspective of NGOs is receiving support in our NGO activity because we know how to act in the area of prevention. We know how to disseminate information. But as you know, as Basia, who is present here, very well knows, it's very difficult for NGOs to secure adequate funding. Therefore, when planning budgets, we have to bear in mind that we need sources for that activities. NGOs also use social media. We cooperate with influencers, and we know it's a great communication channel. In just a moment, we will be launching a self-testing campaign. So I encourage you to follow our social media. All the materials that we will be disseminating will be available in Ukrainian as well. And with the support of WHO, we will be reaching Ukrainians so that everyone can request a test on their own and escape stigmatization and perform the test in a safe environment. Thank you so much, Magda. To those who are most scared among refugees, we can tell them that we can send them to anonymous testing points. That's where, if you have a positive anti-HCV test, that you should contact a GP in primary care and get a referral for an infectious disease center, where you will receive a very effective therapy, as has been discussed during our previous meeting by Mr. Professor. And all others should contact a primary care physician. They will point you in the right direction.
I would not just send them to GP. I will also send them to the foundation of the Star of Hope, because even Polish patients are confused, because even Polish patients don't know where they can get treatment. There are huge discrepancies in waiting times between regions. So search for social organizations. So if you don't have a GP and you have any doubts, look for the right NGOs. They will guide you. So we have a full set of recommendations. And now it is my pleasure to ask Marek Wójcik for the final recommendations in his perspective and to close this session. Well, first of all, it's good that we're talking about all those experts. And I think that we should deal with two strategic issues during meetings like those. So I have a question, and then I'll show my recommendations. We talked about one strategic thing. We should treat Ukrainian refugees like Poles with all the rights and obligations related to that. And maybe we should also be quite bold and stop claiming that some issues are sensitive and that we should be not bypassing them. I'm not sure if it's the time for that, but it's not like the Polish healthcare system is better in all aspects than the Ukrainian one. It's not always the case, and I sometimes hear such claims. And there are some topics that might be considered shameful, but I don't think that if it wasn't better for our relations if we talked openly about it. I'm not sure if you agree with me. I'm posing questions. I'm not saying ultimate truths, but it's the question for Ukrainians, not Poles, really. What do you want? Which approach would you prefer? In those cases which are subject to various myths. In the case of epidemiology, the case is quite clear. Some areas in Ukraine is not as good as in the rest of Europe epidemiologically, but maybe we should talk about it in a straightforward way, because we keep avoiding the topic. We find it a topic which maybe it's better to bypass. So again, it's a question for the Ukrainian guests, what you find most important and when would you feel secure enough in Poland, or when would you treat us like partners where we trust one another and respect one another enough to be able to tell one another everything. And the third issue are my recommendations. I have a few of those. Definitely, social organizations, NGOs are important. Definitely. So the NGOs are coping great with all those obligations. They serve as great contact point. By the way, 3 million people in Poland, 3 million Poles are not actually do not have a selected GP. So we also don't have an awareness campaign directed at Poles. But indeed, the GP should be the first contact point for the patient. We definitely should be educating communication leaders, those leaders, communication leaders from Ukraine, like Mr. Serhipek. It's not like I want to educate you. I don't know everything. And maybe you could also benefit from some additional information. So maybe in a large city, this could apply to several people, to fewer people in smaller cities. You definitely should benefit from additional knowledge and someone who could pass on that knowledge. I think it would be great if we had a joint education project where we reach also for Ukrainians and we carry out joint projects. It can regard, let's say, Polish elderly ladies who are, for example, having a project with Ukrainian children. So we could come up with various combinations. They could have various educational benefits. Even if we are talking about small people, a small number of people invited for the project, we know that news travels fast and it could promote certain ideas. So this should be a systematic, constant set of actions. So we should probably have a standing information campaign, not just something from time to time. And we also keep talking about people who are able to use various digital tools, but we also are facing with recipients who are not digitized. So we should have something like a third age university. It would apply not just for using the healthcare system, but once we've gotten over the worst, we should maybe learn how to live in this new country, because you don't know how long you get to live in Poland. It would be great if the war ended as soon as possible, but it might take a long while. It might take various forms. So we have to adjust. We should not be afraid to think, I want to come back home, but it's not like I'm coming back at any price. So for many people, a return to Ukraine will not be possible for some time. That is why teaching people how things are done in Poland is important. And here I mean mostly people who are unable to, who do not know how to use digitized tools. Poland has done quite a lot. Polish Association of Cities has also done a lot. So we should have as best relations as possible. All that is clear. we are neighbors. And I have this request for organizers. Let's organize another meeting. Maybe we should invite even more practical people because I want to hear more from what you think. Yes, we will definitely be organizing another meeting in this area and with a broader representation of all stakeholders. And I twitched only because we have a question from the room, from the audience. It's not really a question, maybe a comment, because the topic of this session is about integrating within the healthcare system. And it seems to me that we should ask ourselves, shouldn't we be looking more broadly as integration as part of the European Union? How could we also maybe invite a representative of the European Commission to such a meeting to talk about securing funds, to talk about securing public health and human health. And that's important regardless of our nationality. Yes, that's a good suggestion, and we'll do everything to invite also European representatives. I would like to thank everyone, Magda, Ina, the two presidents of the association, Sergei, Marek Wójcik, and you can also watch the rebroadcasting of the session. It will be posted online. Thank you to everyone who stayed until the very end. I am convinced that this discussion will bear good fruit. So a lot of health to you.